the slides show the outline of my talk today. Before showing the data, I'd like to explain the several systems regarding HIV/AIDS in Japan. I'd like to talk about HIV/AIDS reporting system here, definition of HIV diagnosis and AIDS in HIV/AIDS reporting system in Japan, and flow of reporting HIV/AIDS and healthcare providing system. HIV/AIDS reporting system in Japan here. The HIV/AIDS reporting system was implemented in 1985 in Japan. HIV infection and AIDS have been designated notifiable infection diseases under the AIDS prevention law since 1989, and the Act on Prevention of Infectious Disease and Medical Care for Patients Suffering Infectious Disease since 1999. The Committee of AIDS Trends belong to the Ministry of Health, Labor, and Welfare of Japan, reviews the surveillance data and publicly reports. This shows definition of HIV diagnosis and AIDS in HIV reporting system in Japan. HIV diagnosis is defined as at first diagnosis HIV-infected individuals who undertook voluntary diagnostic HIV testing before the onset of AIDS. AIDS is defined as patients who have never been diagnosed with HIV infection prior to AIDS diagnosis and who meet the clinical diagnostic criteria. Number one, confirmed HIV infection, and second, the presence of one of 23 indicator diseases representing opportunistic infections or cancer, irrespective of CD4 positivity lymphocyte count. This shows the flow of reporting HIV/AIDS in Japan. Essentially, as a new HIV infections, including AIDS, are reported by the physicians who diagnose them in hospitals, clinics, or municipal healthcare centers. As reporting HIV/AIDS cases as a first diagnosis is mandatory by law, this system is supposedly highly compliant. Healthcare providers should also report any AIDS or death cases separately as medical condition changes, if the case has been previously reported as an HIV diagnosis or AIDS. This slide shows a healthcare providing system in Japan. Positive cases are referred by the physicians who diagnose them in clinics, hospitals, or municipal healthcare centers to AIDS core hospitals, which are designated by MHLW and are administered antiretroviral agents according to Japanese guidelines for the use of antiretroviral for people with HIV/AIDS. In 1998, HIV infection AIDS was classified as an immune dysfunction state specified by the Act for the Welfare of Persons with Physical Disabilities. Under certain conditions, a person with disability who intends to receive medical services and support for persons with disabilities shall be certified by a municipality to get subsidized medical expenses for services and support for persons with disabilities. Now, I'd like to show you the HIV/AIDS surveillance data in Japan. First, annual change in reported number of HIV infections AIDS and new diagnosed HIV infection in Japan for the most affected subpopulation in 2017, and new diagnosis of AIDS and annual change in reported number of HIV infections in Japan for the most affected subpopulation from 2002 to 2017. New diagnosis of HIV infection by age in Japan, and then current status of HIV tests in health checkups for pregnant women. And this shows annual change in reported number of HIV infection and AIDS. Annual number of reported HIV diagnoses increased by 2008, stayed flat for a while, and perhaps may slightly decline in recent few years. In case of AIDS, the reported number was going up substantially and stayed flat. In 2018, 1,288 new HIV positive cases were reported. This slide shows a new diagnosis of HIV infection in Japan for the most affected subpopulations in 2017. And 82% is Japanese men. Male to male, the MSM and heterosexual contact. In total, 82%. And the MSM, 64%. The 14% of foreign men here, foreign MSM and foreign national men heterosexual contact. And 2.2% of Japanese women, 1.6% of foreign women. People who inject drugs or mother to infant case is 3 and 3 respectively, very small number. And this shows new diagnosis of HIV. Of AIDS. A similar tendency was seen among new AIDS for most affected subpopulation in 2017. And this shows annual change in reported number of HIV infections in Japan for the most affected subpopulation from 2002 to 2017. Although the most affected subpopulations, except for MSM, show almost flat. Here, almost flat. But it is notified that subpopulation of MSM, foreign MSM, slightly increases in recent years. And this shows by age in Japan. There are 39.3% of the age between 25 and 34, and 28% for ages between 35 and 44. This shows the current status of HIV tests in health checkups for pregnant women. And to the questionnaire survey to measure obstetrical and gynecological hospitals over Japan, 82.3% of hospitals responded. The rate of HIV tests in health checkups for pregnant women was 99%, very high. And this slide shows the annual number of HIV diagnoses and HIV tests by municipal healthcare centers. The percentage of HIV diagnosis is HIV tests by municipal healthcare centers. The number of HIV tests by municipal healthcare centers in blue bar, and the number of HIV diagnoses in Japan or by municipal healthcare centers is shown in blue line or dark blue line here. And the percentage of HIV diagnosis in HIV tests by municipal healthcare centers is about 44.5% on average from 2007 to 2018. And this slide shows HIV diagnosis by medical institute in Tokyo metropolitan area, big city in Japan. This slide, more than half of HIV diagnoses were diagnosed by AIDS core hospitals. And hospitals and clinical. In summary of reported HIV diagnosis and AIDS in Japan, number one, of the 976 new diagnoses of HIV infection in 2017, 624 were Japanese men infected by male-to-male sexual contact. 149 were among heterosexuals, and 85 were foreign nationality men infected through male-to-male sexual contact in Japan. Second, the new diagnosis among people who injected drugs or among mother to infants were 3 and 3, respectively. In Japan, most of the pregnant visit maternity hospital for prenatal checkup, including HIV tests, which performed in 99.99% of 1,198 hospitals. Third, in Japan, the physician asks possible infection mode to each patient when diagnosed. So the number of male-to-male sexual contact may be underestimated. Number 4, from 2008 to 2017, HIV diagnosis in Japan remained stable among gay and bisexual men. I like to move to next topics. Next topics is estimating the incidence of HIV infection in Japan. Recently, 2 reports were published. One by Dr. Iwamoto, Professor Iwamoto, and other one by Professor Nishiura. And so in this paper, the HIV prevalence data among people who donated blood for the first time in the Japan Red Cross Society between 2011 to 2015 were weighted by age and sex distribution of the population in Japan as of October 1st, 2015. The number and the status of diagnosed HIV patients was estimated by using nationwide questionnaire survey of the 382 AIDS core hospital Japan. This is a summary slide. Cumulative number of HIV infection by the end of 2015 was estimated 26,670 by using the HIV prevalence data among people who donated blood, as mentioned before. And the proportion of aware of HIV status and receiving ART was 82.8%. 82.8%, and proportion of receiving ALT and achieved viral suppression, it means below the 200, and was 99.1% in AIDS core hospitals by 2015. This slide summarizes the status of blood donation in Japan. The number of donating people in blue, HIV-positive donors in red, and positive persons per 100,000 donors in dark blue. And blood donation is voluntary unpaid in Japan, but there may be some bias. Next one. In this paper, from among Japanese nationals, early incidence data of HIV diagnosis and patients with AIDS who had not previously been diagnosed as HIV positive from 1985 to 2017 were analyzed by using the McKendrick partial differential equation, so-called extended back calculation method. In this paper, if you have any question, please ask Dr. Nishira. I'm not, this is a very complex problem for me. And this slide shows, the proposed statistical model derived from partial equation model, which is referred to as McKendrick equation, which is extended back calculation model. And the important hypothesis is incubation period of AIDS-free since an infection, which is 10 years. Everybody thinks it's 10 years, but somebody says 7.5 years. Other one says 12.3 years. In this model, the hypothesis is needed. The one big hypothesis is incubation time is 10 years, right? In case of 10 years, probability of the, like here, probability density curve is showing black solid line. So, this slide shows comparisons between observed closed symbols and predicted solid lines, yearly number of HIV diagnosis and AIDS cases. Different median incubation periods was assumed. 10 years and 7.5 years and 12.3 years. And, but predicted values are mostly overlapped. Bold gray lines represent lower and upper 95% confidential intervals with median incubation period of 10 years, based on the parametric bootstrap method. This slide shows a comparison between observation and predicted values by sex. Circles represent the observed number of HIV diagnoses, whereas triangles represent that of AIDS case. Solid marks represent males, open marks represent females. Bold gray line represents lower and upper 55% confidential intervals with median incubation period of 10 years. The proposed model successfully captures the observed pattern of HIV diagnosis and AIDS cases by sex. Very overlapped. Very good. And in panel A, this slide shows the estimated HIV incidence and rate of diagnosis in Japan. In panel A, the yearly incidence was highest from 205 to 228. This is increase, and peak incidence is 1,972. And the latest one here, and 1,179. In panel B, the early probability of diagnosis has monotonously improved. And over time, the estimated diagnosis probability by 1999 was less than 10%. But the latest estimate was 15.6%. The qualitative patterns of HIV incidence and diagnosis did not vary greatly even when shorter and longer incubation period, like here. This slide shows the estimated undiagnosed number of HIV infections and the estimated proportion of diagnosis HIV-positive individuals over time among Japanese nationals. I like to mention here that Professor Nishiura focused on the Japanese nationals. Foreigners is he probably try to calculate later. Okay. In panel A, undiagnosed HIV infection was estimated to have peaked in 2009 with 753 of undiagnosed HIV-positive person. And latest one here in 2017, undiagnosed HIV-positive person with 363. And panel D, the cumulative number of HIV infections by the end of 2017 was 29,613 Japanese nationals. Panel D, proportion of diagnosis in latest time interval was 80.3%, including AIDS, like here, yeah. This is for male and for female undiagnosed HIV-positive persons at the end of 2017. And this shows again the diagnosed number of HIV infections and the proportion of diagnosed infections at the end of 2017. In panel A, undiagnosed infections at the end of 2017 was estimated with 5,363. And in panel B, the diagnosed proportion is shown. Open circle indicates including AIDS cases, and closed circle excluding AIDS cases with 50% confidential intervals. Even when AIDS cases were included, the 2,321 deaths known up to the point were subtracted from AIDS case in advance of the calculation. Assuming that the median incubation period was 10 years, the calculation inclusive of surviving AIDS cases yielding 80.3%. When excluding AIDS case, proportion was 75.7%. This is a summary of estimating the incidence of HIV infection in Japan. One, the cumulative number of HIV infections by the end of 2017 is 29,613. And second, estimated diagnosed proportion is 80.3%. Three, accounting for the variation of medical incubation period from 9.3 to 12.3 years, the diagnosed proportion can vary from 77% to 84%. 4. Proportion of aware of HIV status and receiving ART was 82.8% in AIDS-core hospitals by 2015. Number 5. Proportion of receiving ART and achieved viral suppression was 99.1% in AIDS-core hospitals by 2015. Service for future analysis. One, regional variation in diagnosis proportion, like Tokyo metropolitan area or Osaka or a rural area. Age-dependent heterogeneity, young or old versus old, and potentially overwhelmed race groups, non-Japanese and women. This is a diagnosis and treatment status, perhaps living with persons living with HIV in several countries. Panel A from the New England Journal of Medicine, recently published. The panel B is calculated in this paper. And the proportion of, in Japan, proportion of area of HIV status in blue was estimated as at most 80%, according to Dr. Nishiura's paper published in 2019. Proportion of aware of HIV status and receiving ART in yellow was estimated 83%. Very small, but please see here. And proportion of receiving ART achieved by the suppression in gray was 99.1%, according to Professor Yamamoto's paper published in 2017. Overall, viral suppression was 66%. Then conclusions. Among 3 of 1990 targets in HIV care cascade, the first 2, aware of HIV status, 80%, and aware of HIV status and receiving ART, 83%, have not reached to 90% in Japan. The proportion of receiving ART and achieved viral suppression, 90%, was more than 90% in AIDS-core hospital. Further study is required to achieve health and good QOL of all the HIV-positive people in Japan. Thank you for your kind attention.